Hello everyone, you're welcome to Dr. Boms YouTube channel, your number one YouTube channel that brings you very beautiful and interesting real health topics in a way you actually understand. We're glad to have you all back and I hope you have been doing great. Today we'll be talking about a very interesting topic that is also of public health concern, and that is cervical cancer. Today we'll be discussing the symptoms, the causes, prevention, and how the HPV vaccine saves lives. Now let's get into it. Trust me, you want to stay till the end. If you had a chance, just a quick question for someone listening to me. If you had a chance to prevent cancer with just a vaccine or a simple test, would you do it? Because that's exactly what we are talking about today. What cervical cancer really is, how the human papilloma virus, abbreviated as the HPV virus, plays a hidden role in its prevention and also management, how you can protect yourself and your loved ones. So by the end of this presentation, you will know exactly what steps to take. So first of all, we want to discuss what cervical cancer is, as a lot of us must have been asking or wanting to know what exactly is cervical cancer, as you may have lost a loved one or you know someone who is currently having this condition. Cervical cancer is a form of malignancy that happens when abnormals in the cervix, that's the opening of the uterus, begins to grow uncontrollably. Do you know these changes can take up to 10 to 20 years to develop? The cervix of a woman has two parts, the ectocervix and the endocervix. The ectocervix is the visible part of the cervix that you can touch during a pelvic exam, as well as the endocervix. During a pelvic exam, when the doctor is examining the woman's private part, the ectocervix is a part that is visible during the pelvic examination. We have the other part, that's the endocervix, that connects to the uterus directly. So most cervical cancers start where these two areas meet, and that zone is called the transformation zone, where these cancers commonly arise. So the two major types of cervical cancer are the squamous cell carcinoma, which is about 90% most common, and the adenocarcinoma, which is 10% about that. So we look at the global prevalence of cervical cancer. Now, here is the reality. Cervical cancer is the fourth most common cancer among women worldwide. You know, we had discussed breast cancer as well on Dr. Boms YouTube channel earlier on. So please, if you have not listened to the breast cancer presentation, after this you can go back and get educated there, get to know more about ways you can prevent breast cancer or help someone who may be at risk of preventing breast cancer or managing it if they already have it. We go back to talking about cervical cancer, that it is a fourth most common cancer among women worldwide. In the year 2020, there were about 604,000 new cases, as well as 342,000 deaths globally. 90% of these deaths happen in low and middle income countries, like many parts of Africa, Asia, and Latin America. In Nigeria, about 12,000 women are diagnosed yearly, and over 8,000 of them die. I'm sure you may know someone or heard of someone who has died of cervical cancer or who is currently having it. Do you know the saddest part of all this is that you must have heard of someone who has cervical cancer or has died from cervical cancer. So the saddest part of all this is that cervical cancer is preventable. So we want to know what really causes cervical cancer. The number one cause is a persistent infection with the high risk human papilloma virus, the HPV virus. Human papilloma virus is so common that about 80% of sexually active people will get it at some point, but the body clears it most of the time unless it's high risk types like the human papilloma virus 16 and 18. So in other words, what we are saying is that the human papilloma virus is the number one cause of cervical cancer currently, as research has been done on that, and is so common that about 80% of sexually active people will get it at some point. But the good thing is that the body has a way of clearing it most times. So what are the risk factors of having cervical cancer? Number one is early sexual activity. When the cervix is not properly developed and all of that, and the girl child starts having sexual intercourse. So this can put her at risk later in life of developing cervical cancer. People who have multiple sexual partners, as well as presence of HIV infection, as well as long-term contraceptive use over 5 years, the person is at risk of developing cervical cancer. As well as smoking, poor screening rate. Poor screening rate. That has to do with public health. If we don't have a lot of screening going on, it's a risk factor for the devil, because you will not be able to help find out more persons who are having it, and this is a risk, as it will just people will continue having it and dying out of it or dying from it. So like we said, HIV infection. People who have HIV infection, women living with HIV, that they are 6 times even likely to develop cervical cancer. We move over to the next topic, which is talking about symptoms of cervical cancer. The early stages of cervical cancer usually have no symptoms. These patients don't even have issues. They will think everything is okay. But as the disease progresses, you may notice that they start having bleeding after sexual intercourse, in between periods, or even after menopause. They bleed from their private parts. Foul smelling. Some may also notice that they start having foul smelling vaginal discharge, as well as pain during sex, and also pelvic or back pain in advanced diseases. The human papilloma virus vaccination has come to help the continuous spread, to prevent the infection of this human papilloma virus. It prevents the infection by high risk HPV types. Who is supposed to get vaccinated? 1. Girls and even boys aged 9 to 14 before any sexual contact. As young as the age of 9, your girl child or even your son should get vaccinated before any sexual contact. Catch-up vaccines are also recommended for persons that are even up to 26 years old. So it's not really late. If you are at that age, you can still go for a catch-up vaccine. Adults that are also between age 27 and 45 can also benefit. This is based on your own doctor's advice. So It's not something that you should just make the decision on your own. But you've heard the the age ranges that should get vaccinated. So you try and visit a health center or closest around you and find out the hospital wherever you can get vaccinated as quickly and as soon as possible, as this will save lives and prevent us saying unnecessary goodbyes. Another fact is that countries like Australia, where vaccination rates are high, are on track to eliminate this condition called cervical cancer within a few decades from now. So the human papilloma virus vaccine options include the Gardasil 9, in case when you go to the hospital or health center, they are calling the name so that you don't appear ignorant. We have the Gardasil 9, protects against the HPV, the 9 HPV types, and then we have the Cervarix. So we have two forms or types of the HPV vaccine, the Gardasil 9 and the Cervarix. Cervarix protects against the HPV 16 and 18. So it's important that people go for this vaccine and get protected. But the fact that you are going to get this vaccine doesn't replace the need to be screened. You should do your pap smear, screened, and also get your vaccine. Take your vaccine. The pap smear is the kind of test that is done to detect if someone has cervical cancer. It doesn't take time and it doesn't hurt. You just go and it is done for you in the hospital. That is also very, very important. Like we said, even if you have been vaccinated, regular screening is very critical. And we want to mention, like I've already just talked about, the pap smear is a type of screening that is done. This one will help, the pap smear will help detect early changes in the cervical cells, those cells I told you about earlier, those cervical cells, the squamous and the adenocarcinoma cells. This pap smear will help detect early changes in the cervical cells. We also have the HPV test. That one looks directly for high-risk virus DNA. These are all forms of screening that must be done even after the person has been vaccinated. You should do one of these tests, the pap smear or the HPV test, depending on the one that is in your environment or your location. It will help too in monitoring and keeping you on check, especially if you are high risk, maybe a family member has it or has died of it, mother or sibling, or just for your own checkup, for your own well-being. Get screened, get your vaccines, and continue checking up on yourself through this screening test and all that. So recommendations, it's recommended that people start screening at age 21 years. If you're up to 21, you can get screened. Like I said, it is for your good. You can continue also every 3 to 5 years, depending on the test types and the results. You can go to the hospital regularly every 3 to 5 years to screen and still check up on your service and your entire well-being. What has been the global impact of cervical cancer? In high-income countries with organized screening, cervical cancer deaths have dropped by up to 70%. That's why we are talking about the screening and the vaccination. It's helping a lot of countries and it can help your country too, wherever you are listening from. So we should take all that we have said from the beginning of this presentation to now, and even the things we'll still see as we continue with the presentation. Take them serious. You'll be helping not just yourself or family, but your entire country, as the level of cervical cancer in your community can drop drastically. So the treatment options depend on disease. The early stage, that one just requires minor surgery, or people can also do the laser treatment or cryotherapy. Minor surgery including lip, bone biopsy, they can also go in for laser treatment or cryotherapy. Then that's for the early stage. For the later stage, the person may have to go in for hysterectomy, that's removing of the uterus, and also be on chemotherapy, radiation as well. But there are newer forms of treatment, but these treatment options are for people like people who already have the cervical cancer in them. Newer treatments include targeted drug therapies and immunotherapies, giving hope to advanced cases. This also help. Early detection always means simpler and more successful treatment. That is why we are encouraging screening. It is very, very critical. When this condition is detected early, at least you are sure that the person will have a more successful treatment outcome, and we'll all be happy. There are some real steps you can take as to help you with cervical cancer. These are some things you're doing today. Get vaccinated. You've heard of the age range. Get vaccinated if you are eligible. Encourage girls and boys in your family to also get the HPV shot. Get screened regularly. We'll be talking about the importance of regular screening. It will save lives. Practice safe sex. Please stop smoking if you do. If you already smoke, please stop it. Don't need it, because smoking does more harm to your body than good. You should also, as you have heard about or listened to this presentation, you should talk to somebody too about cervical cancer, or better still, share the video if you really can't talk to somebody for fear or because you don't really know so much, have the details. You can just share the video with somebody, as this can help also save a life and even save more lives. So please kill the shame. Talk about it. If you are having any of these symptoms or signs that we have mentioned, please kill the shame. Report to the hospital, or if it's a health center you have around, just report first. They will know when to how to refer you to the hospital, how you get better treatment, or which type of hospital they can refer you. Please don't keep it to yourself. If you are having any of the symptoms we have discussed or the clinical features, please report immediately to the hospital so that you can get screened, and also it can be properly managed, and will have better outcomes. So please, let's make this clear. Cervical cancer is one of the most preventable cancers on earth. We have the power, with the help of these vaccines, screening we've talked about, and treatment options, to stop cervical cancer. It is possible. Once again, please subscribe to Dr. Boms if you haven't, because your knowledge is your protection. And also like this video because you care, and share with someone. This is with someone who matters. Share this video, please. Don't keep it to yourself. Share. Keep sharing, because you don't know whom this video will be of help. So together we can create a world where no woman dies from cervical cancer. And as I already said, there will be no unnecessary or very early goodbye. Please continue to stay healthy.